Hey everybody, this is Jonah Lupton back again with another episode of Startup Sense. We got a great one for you today. It is actually the founder of Remedy. It's Victor. Victor, how are you?
I'm doing well. How are you?
Good. So Remedy is actually something that kind of hits home with me, given that I'm going through a blood clot healthcare scare right now. And what Remedy does is actually protects people from being overcharged on their medical bills. And I think whether you've done the research or not, this is a multi-billion-dollar problem. Um, so, Victor, welcome to the show. Why don't you start off by telling us a little bit about yourself, like a background or bio on you?
Sure, absolutely. And thanks for having me. I've kind of been all over the map. I started my career as a semiconductor engineer, solving difficult problems with people who were much smarter than I was, which kind of caused me to move in onto the more business side of things. And I worked in product marketing for a couple of years, still within the semiconductor space. After finishing graduate school, I came back to the Bay Area and worked in venture capital for a little bit, and then I decided I wanted to go and start something that was really solving a meaningful problem. And so I started a company in the what was not yet called the sharing economy space, and did that for a few years and learned a lot about what it takes to build a business, and more importantly, what it takes to fail at building a business. And when we ultimately shut that company down, I went to go work at TaskRabbit for 3 years. And I helped them do everything from fundraise to start their consumer marketing function to business development to starting a little product group internally, helping to look at various different other strategies. And then after that, decided I wanted to get back into the world of helping people again. So I left there, and after a while, ran across my co-founder Maria for Remedy, and we got to talking about the problem, and I fell in love with the problem and the potential solution for helping to solve.
Awesome. You started the company last year, right? 2015?
That's right. Yeah, we closed our first round of funding in November of 2015, and have been pedal to the metal ever since.
How many co-founders do you have?
There's three of us. Maria, the aforementioned Maria, is the healthcare expert, and she'd been the one who'd researched this problem the longest. And by the time I got involved, she'd already done a lot of the research as to what the size of the problem was, how many people were affected. And then John, my CTO, is a guy that this is now the third company we've founded together. And he and I met in preschool, incidentally. We've grown up best friends our whole lives. And he's developed quite a skill set as a jack of all trades engineer, particularly in the data science area.
So tell us about some of that research. I think we're all kind of curious to know how big this market might be.
Yeah, if you look at, there's some published research in academia from the University of Minnesota, and if you look at an aggregate of all of the audits done by the Centers for Medicare and Medicaid Services in the federal government, you start to see this trend of an incredible percentage of medical bills having errors in them. And those errors end up overcharging patients by quite a lot of money every year. And if you dig into that number a little bit more, you kind of find that that the 70 to 80% of medical bills that are incorrect, that are especially the complicated ones, if you add them all up, you start to see that this is something that the errors alone add up to well over $100 billion of overcharges. And when you consider that the average spend of a household if you aggregate all together all households for how much they spend on healthcare every year, they spend about $1 trillion a year. That's more than the federal government. That's more than insurance companies. That's more than local government. And so any amount of overcharge is pretty significant.
Wow. So how do you, there's a lot of different things I want to certainly ask you, but let's start off with how do you find your members?
So that's a bit of an interesting question, because obviously we're a young startup, so I wouldn't be able to tell you how we're ultimately going to reach members nationwide, but I will say that the organic adoption has been tremendous. We launched at this point a couple of months ago, and the press coverage we had was tremendous. The pickup of that press coverage across other outlets was also very encouraging, and the adoption rate from all of that organic awareness was pretty incredible from my point of view. On top of that, a lot of our members, when they save money, they're obviously thrilled, and so of course they tell their friends and family that this is a solution that they should be looking at. Outside of that, if you look at the people who we are, our mission really is to help people who are on the verge of financial ruin from medical debt. I mean, medical debt is the number one cause of bankruptcy. It drives people into financial hardship and in many cases financial ruin every year. And if you look at the kinds of people who we can really help, these are people whose media consumption habits aren't. It's not Facebook advertising. It's not SEM. It's not digital advertising. It does fall much more into the traditional media space. So radio, podcast, if you're really being generous, remnant television. I think that's ultimately going to be where we reach the audience that we can help the most.
Right. Okay, that makes total sense. Right, people aren't really going on to Google and searching for the keywords that you're probably targeting. I can see where word of mouth, NPR. I mean, where people are getting a lot of their information from.
Yeah, and if you look at when people would search on things like medical bill help, you find a lot of predatory services out there. The personal injury attorneys that try and charge 50% of savings with no cap, and when you're coming to them with $100,000 worth of medical bills, I don't care how much you save, the fee that you're going to pay those attorneys is just as likely to drive you into bankruptcy.
Right. It's the same with the tax relief people and other forms of debt. Super predatory.
That's right.
What kinds of savings is the typical member seeing from your service?
It's still coming together. The way we proved out this concept is we did take one bill at a time, and generally speaking, the bills that we got were really high, the $2,000 plus bills.
Okay.
And the error rate that we found was pretty consistent with the research. We were able to save money for people more than 75% of the time.
Wow.
And in very short order, even during our early alpha tests, we'd gotten to the point where we'd save people over $100,000. What we found? Go ahead.
No, keep going. I didn't mean to cut you off.
Yeah. So we had, so from that, what we realized from that early pool of users is that what they wanted was complete coverage. Because occasionally we would talk to people who we would save a lot of money, but when we were looking at the bills from a given doctor, we would find errors in the $20 copay, or the $30 visit. And that is actually fairly meaningful for a good chunk of this country. And so what we decided to do as a result was move from a world where we were just looking at one bill at a time and move to a model where we were automatically pulling bills in and looking at everything automatically. So now if you look at the overall error rate, it's lower because clearly a $20 copay is going to be wrong a smaller percentage of the time. But it's still wrong occasionally. And that money is sometimes the difference between rent and groceries for the good chunk of this country.
So what does the member do? I mean, do they send you a physical hard copy of the bill that they got from their medical provider? And then do you have to call up the medical provider and ask them about the actual services and then get the person's insurance to see what's covered and what isn't? Like how I mean, this is a lot, very complex.
Yeah, and part of the platform that we're building is to make simple what is currently complex. The likelihood that any individual is going to be able to manage this on their own is relatively low, and so we're here to solve that problem for them. So the way it works is people come to our site, tryremedy.com, and they provide us two major things. They provide us their credentials, their login credentials, their username and password to their insurance website. And we, from there, our system will crawl claim data, and we'll pull data that the first thing we do is we go back in time and we'll pull claims from the previous year to go find bills that were potentially overpaid in a hope to get our members refunds. So we get that claim data, and from that claim data, we see which doctors were associated with those insurance claims. At that point, so the second piece of the sign-up, the second piece of what we need during sign-up is an e-signature on a release of information that appoints us your personal representative, so that we can go and collect information and act on your behalf with your doctors.
Okay.
So when we detect a claim, we'll go to your doctor and we'll request what's called the itemized bill. And this is the bill that sits underneath the bill that you receive in the mail. I'm sure what happens to a lot of you out there is you'll get a bill from your doctor and it says, on this date you visited this doctor and you owe, there's a couple numbers in there that don't make any sense, and then you owe $20 or you owe $400, depending on the various different benefits you have. But what sits underneath that is a list of things that happened, and these are recorded in the hieroglyphic language of medical codes. And there's different systems like ICD-10 and CPT. And our system will pull that data in and it will analyze it all. And it's done with a hybrid of technology that can do a lot of this analysis automatically, as well as a contract network of medical billing specialists. And especially the more complicated ones will make sure that it has a human review, because the likelihood of there being a complicated error is relatively high. But the whole point is we want to power this through technology largely, because that's how you scale this. That's how you scale this platform. We analyze everything. We find errors. Where we find errors, we correct those errors with your providers, and then your bills are either reduced, or if you haven't paid them yet, or you'll get a refund from your doctors.
Why are these healthcare companies still allowed to put that jargon into the bills, knowing that 99% of the people, their patients, can't understand it? Just sounds so wrong.
I actually think that's why they don't send you that jargon. The jargon that's impossible to understand are the medical codes. Yeah. And so they abstract it all away and send you a bill that's just like, this is what happened. I actually would prefer that people get those medical codes, because at the very least they can look at things and get a sense for whether or not things are right or wrong. Right. And if they feel like something's wrong, they can pick up the phone. Like, for example, you might get a lab bill and might just pay it because it's $60. But, and we've seen this, you might be a man getting a lab bill for a pregnancy test. and you would never know it because it's not in the bill that you see. Or, you'll get a bill for an ER visit, and, the procedure was a stitch or two, and they billed you for a life-threatening emergency room visit because they can get a higher rate out of you. Those are the things that you'll never see in your bill, but you will see if you request the itemized bill.
Across the board. Now, I mean, God, I have so many questions I want to ask you, because like I said, this one really hits home with me, and I'm running into some of this stuff myself. What are the most common overcharges or billing mistakes that you guys have seen so far?
It really is all over the map. I would have a hard time pinpointing any one particular category of error. It can be anything from as simple as a misspelled name on an insurance claim submission causing the insurer to deny the claim, all the way up to the incredibly complicated and nuanced coding problem, to things like out-of-network balance billing, where doctors are just trying to extract as much money from an insurer as possible, and then you get this incredibly high bill in the mail. It really is all over the map. It can be simple and it can be complicated.
Now, do you also help them fix the mistake? I mean, you help them identify it, but you help them fix it as well?
We do both. And we think that's because it's important to take people over the goal line. It's one thing to help people identify a very complicated mistake, but even if you know what a mistake is, figuring out who to call and who to talk to and who's actually responsible for fixing the mistake is an incredibly difficult task, because you may call the person who actually should be fixing the bill and they will abdicate all responsibility and they will tell you to call somebody else. Whether or not it's willful or it's just that they don't understand, the person in the billing office doesn't understand that they should be the one correcting it. That is also up for debate. But our system knows who to contact, what to say, how to craft the resolution, and so we can do that very efficiently. Right. That said, we have some patients that say, don't contact my doctors. I don't want you contacting this particular doctor. And so in that case, what we basically just do is we say, hey, listen, we did some analysis. Here's the claim information. We believe that there's an error here. If you don't want us to contact, we don't want us to contact and resolve the error. We can communicate what the problem was separately with our members.
What would their reasoning be for not having you contact their doctor?
It's unclear, but I think there's some instances where doctors will hear, we're a new startup, so a lot of providers haven't heard of us.
Right.
And so, on the super benign side, you find doctors that are concerned about members' privacy. Totally understand that. And we definitely respect the providers that express concern around, hey, I got this request from a company and all the forms are legally correct, but we just want to verify. And sometimes our members are a little concerned that hey, my doctor's expressing concern. So totally respect those kinds of things. On the other side, we also find providers that are willfully trying to overcharge their patients and instill a tremendous amount of fear in using a service like Remedy.
Oh, I gotcha.
So it really can be shady at times. So we encourage our members to say, hey, listen, bear with us. Our goal is to always maintain or improve the relationship with the provider. So if we feel we can't do that, we won't. We'll engage with our members separately.
Now, have you had conversations with some of the big health insurance companies, and what are their thoughts on your service?
We haven't yet, and it's on my list of things to do relatively soon because we are fundamentally, I think, aligned with insurance companies.
Right.
They clearly want their members to be happy. They want their members, well, we hope, they want their members to be happy and be paying as little as possible because it's the whole point of having insurance, and they want to maintain their member base. So we think that we can go a step above and beyond what they already do for their own bottom line, and that is, hey, we can help your patients, we can help your members do the same thing for themselves that you do for yourself. And there's a number of benefits that comes along with relationships with those insurers. But we want to make sure that insurers understand that we're here to help the same member base that they have. That oftentimes, most of the time, the insurer and the patient's interests are aligned.
I mean, so you're kind of doing two things. You're helping the patient not overpay for their copay, but then you're also helping the insurance company by not overpay for, whatever that total amount left over might be, right?
Yeah, that's exactly right. I mean, in many cases, they have the actuarial analysis that will identify the problems in the medical coding, but that doesn't always translate to the patient bill. So in many cases, the insurer, it is absolutely of no difference to the insurer's bottom line, but it is of tremendous impact to their member.
Let's talk about how many employees you have right now at the company.
So we have 8 employees. Most of us are based in San Francisco, but we started this company with the notion of, hey, we want this to be a distributed team because there's clearly a lot of passion for helping to solve this problem that exists everywhere, and talent exists everywhere.
Right.
So as we expand, we want to make sure that we maximize the diversity of our candidate pool. Geographically, socioeconomically, in every way possible.
Where is the health insurance capital? Is Hartford, Connecticut still kind of like the insurance capital of the world?
They're really everywhere. I mean, even the Blue Cross Blue Shields of the world are state by state. United Healthcare, Aetna, Humana. You're talking about the big ones, sure, but there's hundreds of different insurance companies out there, and they really are all over the place.
So 8 employees, all based in San Francisco. What was the first position that you hired for outside of the co-founder? So kind of, if there's 3 co-founders, what was position, for that 4th employee? What were they doing?
Our very first 2 people that we brought on was a head of product. Happened to be someone that I'd worked with before, tremendously talented. And clearly what we're trying to do is build something that inspires trust, right? I mean, our members are trusting us with their data, and we are honored to have that trust. And so our head of product made sure that everything we do, both from a process perspective and a user experience perspective, all is in service of making sure people understand that they can trust us and that our product is operating in a way that makes the complicated simple, so that they understand that that there are bills out there that you don't understand. We're going to make sure that you understand what's going on, and we're going to make sure that we're saving you as much money as possible.
Nice. So you guys have raised money from some pretty cool investors. I know Mark Benioff, the founder of Salesforce, Justin Kahn, founder of Twitch, Haystack, Slow Ventures. Those are the ones I recognize, and there's some in there that I don't recognize. But how did you get in touch with all these investors, and kind of who was your lead investor, and how did you find them?
So our lead investor was a guy named TX, who at the time was running a fund called Carlin, has since moved on and started his fund, a new fund called FICA in Southern California. He's a tremendous guy, and I would recommend that anybody who's looking to raise money should consider him. He's been tremendously helpful. But most of these investors, as basically everyone knows who's starting a company, you meet a lot of people, and then those people introduce you to other people, and God willing, you find somebody whose your message resonates with and agrees to lead an investment. And it just so happened that TX said that he wanted to lead, and all of these other conversations we were having were also from highly interested parties who wanted to be a part of this mission and wanted to be a part of this story. But by and large, the people that we met were people who I or Maria or John had known from a previous life, or introductions that we'd received from those people.
Awesome. Yeah, I mean, Mark's super active angel investor now. You probably don't have a ton of interaction with him, right? Just because he's running a $50 billion company and he's already made 80, 90, 100 investments. But
that's right.
How active?
That's right. I will say that. So he invests through his vehicle, Efficient Capacity, which is primarily run by a friend of his, Mark Goldstein, and so he has been incredibly helpful through Efficient Capacity and through Mark Goldstein. I would. Although you are correct, Benioff is not really involved in the day-to-day. His partner is.
What is the single best piece of advice that any of your investors has given you so far?
Man, there's been so much. I think the guidance around how we should be thinking about prioritizing our proof points. As a seed stage company, you're not going to boil the ocean from day one, especially trying to solve a problem as big as what we're doing. So really a lot of what we're doing is trying to establish a treasure trove of proof points where we can check boxes enough to be able to say, in a future world after we're able to go raise another round of funding, this is the strategy that we have proven. So it's really more along the lines of thinking about how we position ourselves well for another round of funding, as well as I would say that the second most valuable piece of guidance has been helping us think through how to prioritize what we do strategically. So it's not just, hey, go put together a list of checkboxes. It's actually helping us think through what those checkboxes actually are.
Do you think you'll be in partnerships? I think you're going to explore partnerships with some of your health insurance companies so they can offer this service?
That is really something that's on my wish list. So if you have any health insurance listeners, let this be an overture for a partnership. I really would like to be
work in that space. So I could always try to make some introductions to some guys that work for health insurance companies. Maybe they can point you in a good direction as well.
I would love that, because like I said, we're both working in their members' best interests. And I don't think that we're a negative at all for the insurance company. So I would very much like to be working in tandem with insurers.
Are there any numbers that show how many people get a medical bill at some point over the course of the year? I mean, it's got to be at least 50 million people, right?
Oh, it's more than that. 73% of the population visits a doctor every year. There's 1.2 billion instances of contact with a healthcare professional every year. It's a pretty ubiquitous, it's a pretty ubiquitously used service. And this really gets back to the point of why we want to look at everything, because while 70 to 80% of the population are seen by doctors every year, it's really only 7 to 10% of the population that ends up in an incredibly complicated situation and that gets surprise medical bills that are of any substantial size. So our value proposition is incredibly solid and resonates a lot with that 7 to 10%. But the remainder, the vast majority of individuals that receive care, it may not be a surprise medical bill of $1,200, but sometimes a $50 medical bill is also a surprise medical expense.
Do you guys have a minimum?
And so it's that much larger population that we're trying to help.
Do you guys have a minimum? Yes, like You said $50. I mean, if someone
No.
only has a $50 bill, is that even worth your time to look at?
Yeah, so I mean, that's the whole point of building this as a technology platform. We don't want to have this be entirely human powered. I think it makes sense to have humans involved for bills that are on the more complicated side, that maybe involve multiple insurance companies, that have multiple providers, hospital visits. The $20 copay is wrong in a very it's not wrong very often, and when it is wrong, it's there's only a couple ways that it could be wrong. So that's pretty easy for a machine to look at. So we think that the benefit that we bring to the table is, hey, let's build a machine to do a lot of this analysis so that we can bring this to the masses. Otherwise, we would have to put a minimum in place, and that puts us out of reach for a very large percentage of people that would benefit from us.
So what is the business model? How do you guys actually make money from all this?
So at the moment, we charge a percentage of savings. It's 20%, but we cap it at $99 for now. And that really is one, we want to compensate ourselves based on success. So we don't take any money at all if we don't save anyone any money. All of the aggregation of all of your data and putting it in a single place where it's made sense of for you, all of that is free. And we only charge if we're able to save people money. And the reason for the cap is because if somebody comes to us with a $20,000 bill, we're not going to charge 20% of that $20,000 bill, even if we get it entirely eliminated, because that's in many cases as hard to pay as the original $20,000 bill.
Sorry, stupid house phone.
No worries.
I gotta get rid of
No worries.
I think you guys are undercharging. Like 20% sounds low. For real. I mean,
for people like you and me, that may very well be the case. But again, if you think about the kinds of people who are trying to help at large, that could be at the limit of what they're able to pay.
Right, because these people most of them are not going to do the work on their own. They don't
Correct.
They don't know where to go. They don't know where to start. They
don't have the time.
Right.
They don't have the energy. You're absolutely right. They're kind of left high and dry by the system.
What in terms of, you're still a small company, so this probably isn't a dilemma yet, but I mean, in terms of building the right company culture, how do you focus on that? How do you make sure you're hiring the right people, that you're keeping the right people, that was, when you find a person and they're not right, you get rid of them. I know firing is never fun. Even hiring isn't that much fun, but how are you finding the right people, and then how do you retain them and then build the right company culture?
Our very first advisor that we brought on, and who we brought on as we incorporated, was a guy, Chris Holmberg, who is a team dynamics guy. I can't speak more highly of him. He's a guy who I worked with at TaskRabbit in the past, and who does a lot of team coaching at different startups and large companies. But the whole reason we brought him on was to help us be on the same page. And so much of team culture, it involves processes and principles and commitments that seem really obvious when you say them out loud, but almost no teams actually implement them well. Simple things like, hey, when you commit to something, give a deadline and hold yourself accountable to that. That sounds like a truism, but almost nobody actually has a policy and a firm commitment to actually doing that. So we started this company with culture in mind, and every single hire that we bring on board, we evaluate from a culture perspective first. That's on top of that, we are a very mission-driven company, so it's not something that we're not looking for individuals who just want to work for startups and make a buck on the equity. We're looking for people that either have experienced this problem before, or know somebody who has, or has an incredible passion for helping people at large. And we're blessed to be able to say that we found a number of those people, and everybody who's joined this company shares that passion.
That's awesome.
So it comes from the foundation of what's the code by which we operate, as well as who are the people that we are interviewing from day one.
Now, when you hire someone, do you give them the option of higher salary, less options, or lower salary, more options, or is it?
We haven't gotten that far yet. So we generally have approached each hire with a negotiation of salary and equity. We've never presented hey, listen, here's the curve. You can pick one versus the other.
Okay. Yeah, I've seen a few companies do it, but I know it's not mainstream yet, and it's just a little bit more
I
complicated.
totally respect the idea. It's not something that we've even given any thought, but it is an interesting idea that I'm looking at.
What trying to think, what's been the biggest challenge for you guys so far? I mean, I feel like we've probably touched on it a little bit, but does anything really stand out, over the last year plus, a challenge that you guys had to tackle that was just more daunting than you had, thought it might be?
Yeah, every single one of those check boxes I talked about before,
Right.
they've all turned out to be much harder than we expected. This is, like I said, this is a complicated problem. It's an old industry that makes, financial services look like the most technologically forward industry on the planet. I would say one of the most difficult problems that we're building technology to find our way through is the reliance that the industry places on simple old school technologies. Like, there's no APIs, there's no OAuth for data, right? It is, if you are a patient for a doctor, your medical records come to you in paper, in fax, if you're lucky in a PDF, but it's all unstructured and it's all, poorly scanned, and it's all very difficult to understand. So because we are acting as an agent of the patient and we're not part of the payer-provider flow of information, we have to learn how to deal with that kind of data and all of the authorizations and all of the communication that it takes to get that data. So it's certainly been a challenge. We happen to have some really cool technology that we've built that turns that into a fairly efficient process, but that was probably our biggest surprise.
I feel like there's a lot of cool technology out there. It's just that some of these healthcare providers and medical practices are very slow to adopt it.
That's right, and a lot of that is driven by regulation. You have HIPAA, which is the relevant law when it comes to information privacy, and so any change around how data is treated or transmitted is treated very carefully and is vetted with an incredible eye towards detail. So it's not surprising that it's been slow to adopt new technologies, but at the same time, I'm very hopeful that we can drive the change that gives patients access to their own data.
Me too, because I've seen firsthand how unorganized and inefficient, a lot of these medical practices are, not only internally, but dealing with third parties, sending information from, one specialist to the hospital, back to my primary care physician. Like nothing ever goes where it's supposed to in a timely fashion. It's a mess.
Oh, that's right. Yeah, that's absolutely right. And you look at banking and you were able to you had online portals and you had aggregators online 10 years ago that were able to pull your banking data. And that just doesn't exist with healthcare providers.
What does your typical day look like?
It's all over the map. My primary goal right now is going and forming the relationships with the institutions that are going to help this company grow. But I'm a family guy, so I start my morning every day with a cup of coffee with my wife and breakfast with my two kids, and that helps set the tone for the rest of the day. I got to say, I'm blessed to have such a great family to be supporting me in this.
What is your favorite third-party piece of software?
What do I rely on every single day?
There's got to be at least a few.
I mean, there's so many of them as I, sit staring at my mail client and I got to say, my favorite piece of third-party software they don't make anymore, which was Sunrise, the calendar app, because it made scheduling meetings so super easy, and then they've tried to integrate it into Outlook, and it's been a pretty poor implementation of it. That was my favorite piece of software. It's relatively uncreative to say, but
I was actually in the iOS App Store the other day trying to find a calendar that I liked because I was having problems with Google Calendar at the time, but it turned out it was just kind of my phone. So I got the iPhone 7 and now it's working a little bit smoother, but yep, can't live without our calendars. That's for sure.
That's right.
What is one personal goal that you have over the next 12 months?
I want to get to the point where I can say that we as a company have saved people over $1 million in aggregate. It felt so good as an individual and with the team when we got to the point where we could say that we've saved people $100,000.
That's a lot of money.
And I think every order of magnitude above and beyond that is just going to be so meaningful to the people that not just our member base, but to the people who are making this happen.
What kind of growth are you guys seeing on a month-over-month basis?
It's funny. We when we launched publicly, we got more demand than we expected, which is a wonderful problem to have. But at the same time, now we're sort of finding ourselves in the need to scale sooner than we thought. So we've kind of taken our foot off the gas on customer acquisition, which means that our growth it certainly hasn't gone to zero, but it's a lot slower than it would have been had we focused more on customer acquisition at this point.
I mean, I'm not an expert in this area. There's got to be a lot of like consumer advocacy groups that are going to love your service, because they're all about, protecting the consumer in one way or another. So I'm sure that once they hear about your service, they're going to be promoting it like crazy, or at least let's hope so.
Yeah, we talk at least once a week with credit counseling agencies. We've spoken with larger healthcare providers. I mean, these are people who also have, people's best interests at heart. And those are really the people who we want to help. So, doing partnerships with folks like them, I think will ultimately be a big way of how we reach our member base.
Is that part of the business model possibly, is getting referral fees? Because if you help, if some patient submits a $2,000 bill to you and you guys are unable to find any mistakes, so essentially they're liable for the $2,000 and they can't come up with the money, can you then refer them to someone that can help them, negotiate down or, get some sort of a loan to help out? Like, is that part of the business model?
Yes, certainly. I will say, though, as long as we are still guided by the true north of whatever is in the best interest of our members, it's very tempting to say, hey, I'm going to help you get set up with a loan, because that'll provide, depending on the lender, you're going to get a pretty good referral fee for that loan. In many cases, probably more so than what we would have been paid had we saved them the entire amount of the bill.
Right.
So there's a lot of, if you're really just looking at it from a money perspective, you can get yourself in a dark place if you're not holding yourself true to your mission statement. So the answer is yes. We will find products and services that are of the benefit of our member base, and we will monetize those. We won't ever share information outside of the bounds of Remedy, we'll only share the products and services that are truly in our members' best interests.
Awesome. If you could be mentored by anybody, who would it be?
If I'm currently, or if I could be?
If you could be, and they could be dead or alive.
Also a pretty fantastic question. I would say that I have a ton of respect for how Bill Gates has grown, how he grew Microsoft from an early age, and from basically fighting lots of large companies and fighting against a lot of trial and tribulation. And I appreciate how he has wielded his success over the years. So I think the ability to build a big business and select the right people to surround yourself with, combined with an eye towards philanthropy, that's the kind of mentor that I would want.
Awesome. And what is your favorite book or TV show? I don't read books. I don't even have a favorite book. I listen to podcasts, so that's why I kind of give you the, and/or.
So I'm going to geek out on some sci-fi here, because I just finished the trilogy that starts with the three-body problem by, I don't even know how to pronounce his name, but the Chinese author. It was a I really like the sci-fi that's based in hard science and is very speculative in nature. So that whole trilogy was just was epic for me.
And it's in book format or TV?
It's a book format.
Okay.
Sorry, I should say.
How many hours a week do you think you spend reading?
Well, I used to spend, before I started this company, quite a bit. Nowadays, the books that I read are far more, they need to be far more relevant towards pushing my family and my company ahead.
Right. Right.
I would say that I get a chance to read an hour a day when I run in the morning, listening to the book on Audible.
Oh, nice. Okay. Yeah, that's why I love podcasts, because I can
Yeah.
be doing other things, driving, cardio at the gym, whatever, and
Oh, it's fantastic.
consume the information. I don't have time to sit down and open up a book, sit on the couch, and read for 2 hours. I wish.
That's exactly right.
Cool. Well, that's pretty much all I got for you today. Any parting words you want to share with the audience? Where can they find you? And if they want to reach out to you personally, social media, email, whatever you want to share.
Yeah, so we're a young company, always looking for feedback, always looking for smart people to tell us what we're doing right, what we're doing wrong, and we also want to help people out there. So come and let us help. We're at tryremedy.com, T-R-Y remedy.com. We're open for business. Anybody can join. Anybody can sign up.
That's awesome.
And then the last piece of advice that I'd throw out there is for any sort of aspiring founders or people who are sort of debating the direction for their company is that I think there's a tremendous lack of companies out there that are truly trying to help people. There's a lot of, app of the day stuff that's out there, but there's not really a lot of companies out there that are trying to help the people in middle America or the people that are low, medium income. So as you're thinking about what you want to do next, think about what's really going to have an impact on that.
Right. You guys are going to clearly help thousands and thousands of people over the years. So I think it's pretty exciting. The idea of getting overcharged by your medical provider is just, you feel helpless. You don't even know where to start. So I'm really glad that you guys started this company. Looking forward to kind of keeping an eye on things. Are you currently hiring? I mean, I'm going to start a jobs board on the Startup Sense website. So any of the companies I interview, if they're looking for anybody, do you have any specific jobs that you guys are hiring for in any specific locations? Or do you guys have a public job board on your website that I can point to?
Not at the moment, but the second that I do, you'll be one of my first calls.
Okay, perfect. That works. Cool, man. I appreciate your time today. Thank you so much. Keep kicking ass, and you're welcome back anytime.
Thank you so much. Really appreciate the time.
You got it. Have a good one. Talk to you soon.
Take care. Bye.